Dr. Ibrahim Bani will please, the floor is yours to talk about the Yale-Sudan partnership in the research leadership.
First, I would like to thank you for this opportunity and thank Professor Alam for this opportunity joining the WATS International Conference. My presentation is about the partnership between Yale School of Public Health in USA and Sudan, Sudanese high institutions, including four universities and the Minister of Health, and mainly for supporting research leadership among junior to mid-career faculty, as we will see. I would like to recognize my colleagues here in this project. Is Erika is a lecturer, and Dr. Mayur is the associate dean at the Yale School of Public Health, and Dr. Saria Hassan, the assistant professor in Emory School of Medicine, and is also at the Global Institute Health at Yale. I am based here in UAE, Ajman Medical College. I'm going to talk about medical education in Sudan, the initiative and the program which we implemented now. The history of medical education in Sudan goes back in 1924 when they established with Kitchener Medical College, and then it passed through different stages until 1990, in which there is expansion of medical education with 25 new medical schools. And by 2000, they realized that the increase of student intake without adequate resources, really, and qualified trainers, and there is an uncontrolled privatization in which there is a lot of schools without any accountability. Here we see this in 2018, there are about 56 medical schools. Now they're within these 3 years, they increased almost 76 medical schools, and there is only 10 public health schools, and they're all government. Globally, there are about 467 schools and departments of public health, and it's about 1/5 of the medical schools in the world. 50% of these public health school departments are in Europe and USA, and 29% in Asia, 21% in Africa and Middle East. The proportional deficits in global health workforce shows that 2/3 of the global health workforce is in Europe and America, with a 20% global disease, while in Africa and Middle East, the health workforce is less than 10%, with a high global disease burden. The initiative is started by a visit from Yale School of Public Health team, headed by the dean of the school, and the first meeting was the Ministry of Higher Education. This is the office of the Minister of Higher Education, where we met the advisors to the Minister of Higher Education. Also, we met the Minister of Health, and the partner institutions include 4 universities. 3 are government public universities, and 1 private, Al-Ahfad University for Women, and also the Public Health Institute, which is a part of the Federal Minister of Health. The partnership started by the meeting in Khartoum College of Medicine. It's the first meeting in which we discussed the partnership and the roles of different partners. And on the next day, 2nd of March 2020, we had a workshop in which attended by all partners. And in the workshop, we discussed the curriculum of different public health programs. Here's the core curriculum for the public health program, the 5 institutions, and with the concentrations mainly health policy, reproductive health, and not all the partners have concentration. Most of them, they have general Public Health Program, or MPH, Master of Public Health Program. These are gaps identified that there is a need, especially in advanced epidemiology and biostatistics, research methods, applied public health, and implementation science, which addresses the gap between research and practice. Also, it's decided that there is a need for faculty development, leadership, scholarship, and mentorship. The rationale for this partnership, that a strong public health workforce is essential for achieving the Sustainable Development Goals, and also the strong public health workforce is essential for ensuring effective and sustainable growth of healthcare workforce, and also effective public health uses stakeholder engaged to approach to identify the relevant gaps. The objective mainly that Yale and the partner institutions were to develop a sustainable strategy to increase the institutional capacity in advancing the public health education, and this through focusing on public health, applied public health with emphasis on applied research methods. Also develop a strategy to include curriculum content which will be shared between the institutions, and even they share the resources. And some institutions have professors which can be shared with others, and develop a strategy for faculty development. And given the limited progress towards 2030 Sustainable Development Goals in Sudan, there is an urgent need to improve multiple levels of public health, including public health workforce. And since late 2018, Yale has been working develop partnership with these 5 institutions in Sudan, the 4 universities and the Public Health Institute at the Ministry of Health. This is the first meeting in which launching the program. And the program which agreed is the what's called the Public Health, Strengthening Public Health Leadership Research, Public Health Research Leadership. And this program is containing 4 modules: creating leadership network, fostering mentorship, leading research teams, and supporting scientific writing. Actually, the program started in June, last June, and we completed 3 modules out of the 4 due to the ongoing situation in Sudan, the turmoil, which now since October, especially we stopped October 25 during the coup. The modules were included synchronous weekly interactive sessions with the Yale faculty, but also include some panel discussions with Sudanese experts from within Sudan and outside Sudan. They discuss different issues like the national research agenda and mentorship. And also the students have access to the Yale online learning platform, Canvas, in which they have readings and assignments. And also participants who complete these 3 modules, they get a certificate. This is the first lecture in June 24, and it was all online. At the first beginning, the plan was that the participants to go to Yale for 3 months, and also the Yale faculty come to Sudan to teach the courses. But due to the COVID, and we changed it into an online program. This is one of the panel discussion with experts from Sudan, from US and the Gulf countries. Same, here we also take attendance. It's one of the universities, Yale University, almost 100% attendance. We describe here these programs called the research program, which is started since June and is continuing. And we have to start the first module, which is scientific writing, but it stopped since October 25th after the coup. and mainly to foster a networking of junior to middle. Most of them are lecturers or assistant professors, or just graduates with the Master of Public Health, nominated by the institutions. Each institution nominated around 5 to 6 participants. And this, it's a virtual program, and the funding was from the United States Embassy in Sudan. And the program initiative was successfully implemented also in other low and middle income countries, like in South Africa, the same leadership program. Usually the program started by nomination of the participant by the deans and the director of Public Health Institute, and each participant have a champion or a mentor to help him or to guide during the program. Also, there is coordinators from each institution to facilitate the adaptation to the program. This represents the program coordinators from the Ministry of Health and the other 4 universities, as you see, Nilan University, Ahmad, Khartoum, and Jazeera. We evaluated the program using the Kirkpatrick model, which is a global model for evaluation of training programs, which include participant retention, engagement, satisfaction, change in competency, and translation of skills into action. However, the data for this not yet analyzed yet, because still we are working. But the preliminary result shows that we have about 29 participants, 8 are males, 21 are females. And during the first 2 modules, 75% had met the participation requirements, that they should attend at least 80% of the program. And survey was done, 100% was satisfied. The longitudinal self-assessment is ongoing, and still the results will be provided later and analyzed and will be published. This is the graduation ceremony. We graduated the first batch after 3 months of attending these 3 modules. This is a graduation ceremony. We expected impact that to introduce high level of health research, to produce more research, because these groups will be working in teams and they will apply together for grants and work as team members. Raise research profile of Sudanese scientists, and this model can be applied to other disciplines, not only public health. So in conclusion, the program fostered a collaboration among US and Sudanese institutions who are engaged mainly in public health, effective support mainly in this program to junior and mid-level faculty, so that they could have a sustained impact of applying public health professions every time we train, and this they will also train others and us will be as mentors. And this proposed partnership will focus on developing a model for strengthening graduate public health program through this leadership program, through applying advanced courses in research and epidemiology and biostatistics, through developing certificate programs. And this will help to ensure achievement of SDGs and universal health coverage. And in this program, partnership between the Ministry of Health and Ministry of Education is very critical. The take-home message for this program is that lessons learned from adaptation and implementation of this program of leadership in public health research and the evaluation of program will have implications and plans to extend this program. We are planning to extend the program to other universities, especially in zones, university in conflict zones, like in Darfur and Eastern region. So this is the plan, and we'll work using these approaches to strengthen the public health program. Thank you.
Thank you, Professor Bani. I thank you a lot for this very interesting presentation, and especially the take-home message, the key take-home message.
The So please remember, if we all help and do a little bit, it will make a big difference.